Auzubillahi Minash-Shaytanir-Rajim. Bismillahir-Rahmanir-Rahim. Today we will be discussing the anatomy and functions of different structures of the eye briefly. So first of all, I always say that whatever you are going to learn or study, the first thing you people must be knowing is the structure of that thing. If you don't have an imagination of the structure of any particular thing, then you can't move forward. So, regarding eye, I'm going to make the sagittal section of the eye. This is cornea, okay? This is sclera. This is the outermost layer of the eye. It is called fibrous layer, and this all layer is made up of collagens, right? That is ground substance. The sclera is non-transparent white part and cornea is transparent. Then this is the upper eyelid and this is the eyelash. This is lower eyelid and this is eyelash. Up, up, outward and downward, and upper is outward and upward. This is the normal anatomy. And the space between this eyelid and the sclera is conjunctiva. Then this the junction between cornea and the limbus. Cornea and the sclera. It is called limbus. This is iris. Okay, and the hole or defect or a aperture in the iris is called pupil. The space between the iris and the cornea is called anterior chamber. Are you getting my point? I am trying to make it very simple, and I suggest that you practice this simple diagram. And whenever you are going to attempt or think about any disease of the eye, if this diagram is in your mind, then you will be able to uh, you will be in a very good position to answer to clinical questions and other things. This is the anterior chamber, this is the cornea. Now here is the ciliary body. It is not visible. Ciliary body is in continuation with the iris, and from the ciliary body are the zonules or suspensory ligaments, and suspensory ligaments are holding the crystalline ocular lens, transparent crystalline ocular lens. Okay, and from here to here, this is the vitreous cavity, which contains vitreous humor. This is the aqueous chamber, anterior chamber. It contains the aqueous humor. It contains the vitreous humor. Then this is the outermost layer, the fibrous layer, the middle layer. Middle layer starts from the ciliary body, and in continuation with that, this is the choroid, and it is attached with the ciliary body, which in turn is attached with the iris. So iris, ciliary body, and choroid make the middle layer, which is the vascular layer, middle vascular layer. And then the innermost layer. Innermost layer is the neurosensory retina. Got it? This is the neurosensory retina, and here is the optic nerve. This is the schematic basic anatomy of the eye from the sagittal section. Now, from the same diagram, we will try to find out the functions of gross functions of different structures. Basically, eye is meant to see, and all the apparatus present in the eye is made to make a sharp image in the center and dim image in the peripheral view. Like if I am looking straight ahead at, for example, at for example, on the face of a student, then I am seeing his face very clearly. At the same time,
Something went wrong. Please try again.
Close the red button below, not the recording button.
Yes, sir.
On the right side, this is voice, okay. And having looking at the center point where I am seeing the sharp image, at the same time I am looking, my eyes are giving me the information from the periphery which is not very clear. These are the real fields. Now, first of all, when the air comes, light rays come, they first of all strike to the cornea like this. Okay, like take the two corneal rays, and after that they are converged, and then they are further converged by the iris. Sorry, lens. They are, let me make it, they are converged, right? Then they come to the iris. Let me make it a little bit more clearer. This converges, and when it comes to the lens, it converges a little more. Okay, then it is, the second ray is coming from the cornea and it converges, and when it comes to the lens, it converges more, and it forms a single sharp image on the part of the retina which is called macula lutea. Now, total power of the eye in diopters is 58.6 diopter. You can say 60 diopters spherical for the sake of simplicity. Out of this 63 diopter, out of this 60 diopter spherical power of the eye, 43 diopter spherical is contributed by the cornea, because it is the first interface which the eyes rays of light encounter. Understood? So 43 is given by the lens. Subtract 43 from the 60. How much is it?
Sir, 17.
17. So the remaining 17 is contributed by the lens. Maybe you can say 15 is contributed and the other 2 is contributed by aqueous humor and things like that, but the remaining 17 diopter spherical is contributed mainly by the lens, and they converge the rays of light and make a sharp image of any object. This is the main function of the, now the structures which you have studied, the function. Cornea's main function is to converge the rays of light. Lens main function is to converge the light, and neurosensory retina macula lutea has the cones. It perceives the images as photoreceptors, and the image is formed uh, inverted at the macula. And in the cerebral cortex, it goes and it is erected, or it is seen as it is. So brain changes its position upside down and laterally inversed. Okay. Now other important functions briefly apart from vision. Uh, the aqueous humor, which is secreted from the ciliary epithelium. This is ciliary epithelium. From here, this is the posterior chamber. Posterior chamber, very small part between the lens and the iris. It is secreted. Aqueous humor is secreted from the non-pigmented epithelium of the ciliary body, and through the pupil, it comes into the anterior chamber. The junction between the iris and the cornea makes the trabecular meshwork, and through the trabecular meshwork it goes out into the episcleral veins, and through the episcleral veins into the general circulation. This is the secretion and excretion of the aqueous humor. Understood? And if the intraocular pressure is increased above 21 mm of mercury, 20 mm mercury till is normal. If it is persistently 21 mm mercury, there should be a suspicion that the patient is having glaucoma, which is called kala motia in Urdu, and it is a silent killer. It causes It is the most common cause of irreversible blindness worldwide because it damages the optic nerve. It is an optic neuropathy, and this is the dynamic of intraocular aqueous humor, and it's uh, because of the aqueous humor the intraocular pressure is increased. It is usually uh, it is not very well understood whether the aqueous humor is secreted more or drained less, by which it is accumulated in the aqueous humor. By anyways, when it increases in the aqueous humor, the pressure increases. Secondly, uh, the other functions in the ocular structure, lens. It the sole function of the lens is to, till the age of 40 years, it focuses the image at certain points like here and here. It changes its shape according to the contraction and relaxation of the ciliary muscle. It becomes oval, it becomes steep. When it becomes oval, the power is increased, and when it becomes steep, the power is decreased. You people must have seen that after 40 years, almost all the people use the reading glasses. It is because the ciliary muscle and the lens both become sclerosed, and they are not now, lens is not now not able to change its shape as frequently. It is a situation or a condition which is called presbyopia, and it is normal aging process like whitening of the hair. uh, if for example, usually after 60 years or around about 70 years, the lens, which is made up 98% of it is made up of proteins and water. The proteins are coagulated because of aging, and they convert into the clear lens is converted into a whitening structure, and we call it cataract or Safed Motia. And cataract is the most common cause of reversible blindness as opposed to glaucoma, which causes irreversible blindness. It causes reversible blindness uh, and biopacification of the lens. And we do the cataract surgery. We replace this opacified lens with artificial lens, and the patient regains his visions to 6 by 6 if there is no other problem on the retina or any other place. For near, he will continue to use the near glasses. Nowadays, some intraocular lenses are uh, being made, which are uh, set both for far and near glasses are no more required. Now we come to the retina. The sole function of the retina is that to perceive the images, and retina is projected upside down and laterally inverse. For example, if this is my right eye, this is my temporal retina. If rays of light are falling here, they will be perceived by me as something on my nasal side. And if something is on the nasal side, I will see it on my temporal side. Similarly, upside down. So, brain makes the trick, and uh, makes us is easier for us to see it as they are actually present. Uh, the two important landmarks in the retina, one is the macula, which is responsible for the sharp vision, and one is the optic nerve. This one, this is macula, and the macula is not a structure which can be seen. It is a, you can say, if this is retina, look at my hand. If this is retina, then this dip in the retina is macula lutea. Actually, it is not a separate structure. And optic nerve, yes, it is a separate structure. It has got four parts. Cranial nerve coming from the brain and enters 1 millimeter inside the eye, and from 1.2 billion ganglions in the retinal nerve fiber layer. Uh, Axons of all the 1.2 billion ganglions make up the optic nerve, which combines with the optic nerve of the other eye and makes the optic chiasma. And it takes away all the information, all the vision, central vision, peripheral vision, night vision, color vision, all these things are carried out by the optic nerve to the brain at the area 17. Okay. Then the middle layer is the choroid. Choroid is a vascular layer. Its basic function is to give the nutrition to the retina. Retina is neurosensory retina is also vascular. It it gets oxygen not only from central retinal artery and drained by central retinal vein, but it has a dual nerve supply. It gets the second nerve supply from the choriocapillaries, which is present just behind the retina. Getting my point? Behind the retina is the choroid, and the function of the sclera behind the choroid is the sclera. Function of the sclera and cornea, being a fibrous layer, is to keep the shape of the eye integral. Don't let it collapse because they are fibrous layer. And the anterior part is transparent, being the cornea, and there are many reasons why cornea is transparent, and we will discuss it later when we will discuss in detail the cornea. So this is the basic structure and basic functions of an eye. Thank you very much.